I had to have some minor surgery under general anaesthetic, and then I had to have MRI scans. And even though I'm a doctor and I know the health system, it certainly makes you realise, even for a day, how vulnerable those gowns make patients feel. You have to get rid of all your day clothes. You're not allowed to wear underwear. You often have to walk down a breezy corridor just before you're having a general anaesthetic. So it's hard to keep your dignity and keep covered up. And I think there's something about taking away people's personhood and their comfort. Now, it's fine for me as an NHS doctor who knows the system, but you can imagine if you don't speak much English, you're an older female, maybe you're from a background where modesty really matters, it would be more alienating still. Hi, my name's David Oliver. I am a consultant physician working in geriatric medicine and acute internal medicine in the UK, and I also write in the British Medical Journal every week.
In his article last month, Dr. Oliver said health professionals should be asking why we make patients wear them.
I think the first thing to say is there are times where a hospital gown has its uses. If you're going to have an operation or a procedure, you're in intensive care and you're stuck in bed with wires and tubes coming out, of course you need an accessible garment. And maybe if you've come into the emergency room following trauma and you need a whole body examination. The problem is patients are often kept in those gowns far beyond the period where they're really needed. That's the first thing. And the second thing is that the design of the gowns is terrible. Certainly the model that's used in the UK flaps open at the back. It's very hard to do up, even for able-bodied people. It often leaves the back and the bottom exposed and leaves people feeling very vulnerable. And if you're already frightened, sick, in a strange environment, maybe you're confused, it's not dignified, and it's certainly not going to encourage you to get out of bed and moving and get back on your feet again. In my BMJ column, I cited some work by some researchers in Scotland, Liza Morton and Nicola Cogan, and they surveyed over 900 people about what their experience was of wearing the gowns, people between the ages of 18 and 90. And about 2/3 of them said they couldn't do them up properly, they felt vulnerable, they felt exposed, they often felt they were wearing them well beyond the point where they were really needed.
You painted a startling picture for me because I hadn't thought of it until you said it. But what's the link between being a patient being handed a gown and a convicted prisoner being handed a jumpsuit?
Well, I've been on a couple of prison tours, one in South Africa to Robben Island where Mandela was imprisoned, and one to Crumlin Road in Belfast. And the first thing you see there is the way that they shower people down, put them into prison uniforms and take their own day clothes away for the duration of the sentence. And there's something symbolic about the minute you arrive in the hospital, having to get rid of your ordinary clothes and get into this alien, open at the back garment, which symbolises becoming a patient. So I think seeing people in their day clothes, it makes you treat them differently for sure. Because what tends to happen is the minute people hit the front door of the hospital, if you're not careful, they're into the gown, they've got the wristband on, they've got a drip in their arm, and suddenly from hero to zero, we've medicalised them. And of course, if people are very sick, you need to do that. But then they're onto the conveyor belt. And there is a definite push to have more people go to ambulatory care, get them seen in their day clothes, in their shoes, in a rapid response clinic, and not routinely institutionalising people the minute they hit the front of a hospital. So we've got into a habit of putting people in gowns for the sake of it.